that constant lump in your throat that you keep clearing, that sticky white or yellow ribbon you cough up every morning, that feeling that something is always dripping down from the back of your nose. If this sounds familiar, you are not imagining it, and you are certainly not alone. Most people with this problem never tell anyone. They just clear their throat in the shower, at their desk, before a meeting, and assume it is just how their body works. It isn't. There is a specific medical reason for it, and once you understand it, you can usually fix it without strong medication, without harsh sprays, and without spending a fortune. Let me show you what is actually happening inside your body. Your nose and sinuses produce roughly 1 to 1.5 liters of mucus every single day. That is normal. You don't notice it because it normally slips down the back of your throat in a thin, nearly invisible layer, gets swallowed, and disappears. The problem starts when something changes the volume, the thickness, or the location of that mucus. And there are really only a few things that can do that. The first is the one your doctor almost never checks: silent reflux. Medically, it is called laryngopharyngeal reflux, or LPR. Classic reflux gives you heartburn, a burning chest, a sour taste in the mouth. Silent reflux does none of that. Instead, tiny amounts of stomach acid travel upward, past the upper esophageal sphincter, and bathe the back of your throat and your voice box. That tissue was never designed to handle acid. It reacts by swelling and producing protective mucus. The result is exactly what you are experiencing: a constant sense of something stuck, frequent throat clearing, hoarseness in the morning, and a thick glob that loosens after coffee or meals. ENT centers across the country now recognize LPR as one of the most underdiagnosed reasons for chronic throat mucus in adults. But reflux is only part of the story. The second, and often bigger cause, is what we call postnasal drip. This is the simple fact that your nose is producing more mucus than your throat can quietly handle. The triggers are surprisingly ordinary: allergic rhinitis, dust, pollen, pet dander, mold. Non-allergic rhinitis, perfumes, cleaning products, cold air, strong smells, even changes in weather. Chronic sinusitis inflames the lining of your sinuses and creates a slow, steady drip that never stops. Certain blood pressure medications, like ACE inhibitors, are well known to cause the same problem, as do some antidepressants and hormonal shifts during pregnancy. The nose has more than one way to overreact, and most patients have more than one trigger acting at the same time. Here is what most people miss entirely. The mucus you see in the morning is rarely being made overnight. It is being made during the day, but it thickens because you are dehydrated. There is real science behind this. Published airway research has shown again and again that when your body lacks water, the water content inside mucus drops. The mucus becomes sticky and dense, and the tiny hair-like cilia that normally sweep it along lose their grip. You wake up, you cough, a thick piece comes out, and you assume your body was overproducing all night. In reality, your body just lost its ability to clear what was already there. Anderson's widely cited work on airway hydration and reviews by Randall and colleagues both confirm the same principle. Underhydration changes mucus from a flowing gel into a sticky paste. So now the real question: what actually works? I am not going to hand you a long list of supplements or a complicated protocol. The evidence points to a short set of changes that, taken together, resolve the problem for the majority of people within 2 to 4 weeks. The first is water, and I mean therapeutic water, not casual sipping. Aim for roughly 35 milliliters per kilogram of body weight every day. For a 70-kilogram adult, that is about 2.5 liters. Spread it across the day rather than downing it at night. The goal is not flooding your stomach. The goal is keeping your mucus layer at the hydration percentage that lets cilia move it freely. The second is a simple nasal rinse. A daily isotonic saline rinse, either a neti pot or a squeeze bottle with sterile water, physically removes allergens, irritants, and thickened mucus before they can drip into your throat. Clinical reviews place saline irrigation as a first-line therapy for both allergic and non-allergic rhinitis. It is cheap, it has almost no side effects, and it works. The third is to identify your hidden reflux. If your throat clears more after coffee, alcohol, chocolate, large late dinners, or tight clothing. That is a strong clue. A 2-week trial of avoiding these triggers, eating your last meal at least 3 hours before bed, and elevating the head of your bed by about 15 centimeters, is enough to know whether LPR is part of your story. If it is, you have a real treatable cause, not a mystery. The fourth is to look at your triggers honestly. Scented candles, heavy perfumes, household sprays, smoke, dusty bedding, pet dander in the bedroom. Non-allergic rhinitis is now recognized to respond well to certain prescription nasal sprays. Ipratropium bromide has solid randomized trial data behind it for runny nose dominant symptoms, and azolastine has shown clear benefit as well. But most patients improve dramatically once they simply remove the daily irritants they didn't realize were inflaming their nose. If you wake up tomorrow and do just 3 things, drink enough water across the day, rinse your nose once with saline before bed, and stop eating 2 hours before sleep, you will likely notice a real change within a week. If the problem persists beyond a month, or if you also have nasal obstruction, loss of smell, blood in the mucus, or unexplained weight loss, that is the point where seeing a clinician matters, because something more specific is going on. I have seen hundreds of patients with this complaint, and the honest truth is this: chronic throat mucus is rarely a sign of something dangerous, but it is almost always a sign that something about your daily environment, hydration, or reflux pattern can be fixed. The body is not betraying you. It is signaling. The simple solution has been sitting in front of you this whole time: water, a rinse, and the discipline to remove what is irritating you. That is usually all it takes.